The Trump administration has released the final rule on association health plans. This came out of the Department of Labor after a proposed rule was circulated with a public comment period earlier this year. We've been talking about association health plans since October, when Trump signed an executive order instructing the Department of Labor and other federal agencies to make it possible that association health plans could come back to the mainstream. Now, association health plans simply means allowing small businesses to band together to create their own health plan and thereby be regulated more like large group insurance plans instead of like individual and small group insurance plans, which therefore takes them out of the requirements of the Affordable Care Act and instead subjects them to the requirements of federal ERISA rules. So that means that if you're not subject to the Affordable Care Act requirements, you're not subject to a lot of the consumer protections of the Affordable Care Act. So let's look specifically at who this applies to. The rule allows the following people to join together to buy or provide insurance in the large group market. And this includes small business owners, small business employees, sole proprietors, and other self-employed people. It's a pretty broad definition of who can now band together to buy association health plans. Now, association health plans aren't new. They've been around in different formats. They fall under the employee benefit program category known as multiple employer welfare arrangements. Historically, these were not traditionally good plans. Now, they were called junk insurance. Many people were very skeptical of their success because they had this history of fraud and abuse, even as identified by the Department of Labor, the same agency that just issued this final ruling saying, let's bring them back and let's regulate them differently. Now, they were loosely regulated, they're undercapitalized, many of them were unable to pay benefits, thereby depriving members of meaningful coverage. If you're thinking this sounds a lot like something we've been talking about lately, it's a lot like the history and the track record of short-term insurance plans. Spotty, not really covering a lot, people might be paying premiums and then finding that it doesn't cover what they need. Now, it was actually federal legislation in the 80s that placed association health plans under state control because of this spotty track record and the history of fraud and abuse. What this final proposed rule, the final rule now in its final form, does is takes it out of the control of the states and puts it back to the federal government once again, which is where all the trouble started in the first place. So history is kind of repeating itself. We're not learning from our mistakes, and instead we're putting association health plans under federal control under the large group market. And now we're going to say to consumers, go ahead and buy these cheaper plans, and good luck if they're going to actually cover what you need. The rule exempts association health plans from the core Affordable Care Act requirements, such as newborn and maternity care, mental health, substance abuse, emergency services, medical loss ratios, and premium rating restrictions. And it could actually charge people more based on age, gender, geography, while excluding benefits at the same time. The impact of this, of course, diluting the number of healthy enrollees in the individual market. Whenever there's something out there chipping away at the edges of the Affordable Care Act, like association health plans and short-term insurance, what you're actually doing is pulling healthier people out of the marketplace by offering the cheaper alternative. But it's really not an alternative. It's an apples to oranges. It's a cheaper product, but it's not giving you comprehensive coverage. The Department of Labor expects that as many as 11 million people could join association health plans. We see now different rules impacting different pools of people, which usually builds instability in the marketplace. We're going to be skewing the risk pool in the Affordable Care Act marketplaces toward the sicker, costlier enrollees, which, drives up premiums. Now, the immediate impact is a 2 to 3% impact of premiums. A little bit longer term, we see that number rising a little bit higher, destabilizing the digital market and taking us back to the bad old days of insurance, like we said. Now, the timeline for this is not implemented yet. The rule was finalized. The Federal Register usually says that a rule will go into effect 60 days after publication in the Federal Register. The way that the Department of Labor wrote this final rule was to do a staged applicability process, depending on if you were already in a fully insured association health plan, if you're an existing self-insured association health plan, or if you're starting a brand new self-insured association health plan. There are 3 dates that they spell out for implementation dates. But let's hold our horses just a little bit. A couple states such as New York and Massachusetts, have indicated they plan to sue on this rule as not complying with federal law. You can read the federal final rule yourself. We put the link to it here. You can also read some of the most recent news coverage on this that's talking about the provisions that are most specifically rolling back Affordable Care Act protections for consumers. You can share your thoughts with us. What do you think about the new final association health plan rule? What impact do you think that will have in your state or in your insurance market? And you can send us a question, and you can do that at healthwatchwisconsin.org.